Have you been injured in a car accident recently? My name is Dr. Leo Boisvert. I've been in practice for coming up on my 30th year, and I practice here on Nicholasville Road in Lexington. Top three reasons why you would want to get evaluated quickly after a car accident. Number one, you have a chemical released at the time of impact. In fact, various chemicals that cover pain. So you might be thinking at the scene, I'm okay, no big problem. I think I'll be fine. And you might even make that statement to the other driver or to police. But give it 24 hours, you might start really feeling some aches or pains, and you want to be evaluated by a place for a reasonable amount of money. That's my emergency room. It could cost you $2,500, $5,000 in 15 minutes time. You may not need all that diagnostic work done. So number one reason, reasonable and prompt service. That's number two, I'm a chiropractor. I've been doing this, like I said, for coming up on 30 years. But manipulation to the neck, particularly right after a motor vehicle collision, is not necessarily what you need. You probably need some mobilization, some real gentle figure eight type stuff, not a big crack pop to the neck, at least not in the beginning. You may not need it at all. If you had a disc injury, you might want to utilize non-surgical spinal decompression here in our office, which is now covered by Kentucky personal injury carriers. So those are good reasons. And then the third reason is if you let time pass, abnormalities, positions, bones out of position, bones that are stuck and jammed, they kind of get used to that. You don't want them to get used to it. You want them to be put back where they belong and begin moving again a reasonably quick amount of time. Fourth reason why you might, this is the bonus reason, if you let 3 or 4 or 5 or 6 or 7 weeks go by before you decide to do something about that pain that just won't go away, well, imagine your State Farm or your Progressive or your Farm Bureau or whoever your carrier is. It's not unreasonable for them to think the question or the thought, I wonder if the reason for the 6-week delay is that it didn't really happen in the car. You know, there's people that would do that. You wouldn't do that, but you need to report that accident and then get evaluated by a licensed healthcare professional quickly, within a reasonable amount of time, so that it's clear that the injuries you sustained in the car are exactly what you're presenting for here today. Your motor vehicle crash, your car accident, if you had neck pain that radiated down either of your arms, neck is also in medical terms the cervical region, or if you had lower back pain, lumbar pain that radiated down either of your legs, and not just pain, but if you had numbness or tingling, altered sensation, strength changes, any of those things, that can manifest like I used to be able to type 60 words per minute, and now since that car accident, I can only type 18, things like that. If you have symptoms in your extremities, you may have injured a disc during the car accident, and you need non-surgical spinal decompression. The equipment behind me is true non-surgical spinal decompression. There's a lot of let's say not really decompression systems out there that are more like pulley systems. Our system, the DRX 9000, is true, real spinal decompression, by which I mean it's not just traction. Yes, it's traction-like. If I were talking to an uninformed group, I would start with what they understand. People generally understand what the word traction means. But ours is spinal distraction. That is where we gently separate the space between the bones. Spinal distraction without muscular contraction. And that's what traction can't do. Traction is very linear. It's very abrupt and jerky. Our machines pull on a logarithmic curve. Just hear that as a very, very gentle curve where the force starts low, very slowly peaks, and then lets off. It is a relaxing, healing experience, and we own 5 of these DRX 9000s, and we'd love to help anyone who's been injured in a car accident. It is now covered by Kentucky personal injury insurance, and it's a great chance for us to help whoever's been in a car accident without, especially if this is one of the reasons you don't see a chiropractor, without a lot of cracking and popping. Very, very gentle, very, very safe, and now covered by car insurance in Kentucky. Frequently in our clinic, when someone's had a car accident, we use something called a Class 4 laser. Our lasers are set to reduce pain and inflammation. So you've heard about lasers. You've heard about lasers used in surgical procedures. Lasers are majorly on the scene in healthcare. We use a class 4 laser here. So it's not a surgical cutting laser, but it is a laser that lessens pain and inflammation. It stimulates a chemical that's made in every cell in the body called ATP, adenosine triphosphate, and that is the mechanism or the initiating mechanism that drives the reduction of pain and inflammation. So they're not fat melting lasers, they're not hair removal lasers or tattoo removal lasers. Our lasers are set to reduce pain and inflammation, and they play a big role in how we handle especially acute, meaning it just happened and I am hurting, car accident cases here at Today Disc Bone and Joint.